Hello and welcome to the 5th video about the article How Parents Contribute to Children's Psychological Health, the Critical Role of Psychological Need Support. There are many different determinants in young people's development, but the role of the parents is paramount to healthy psychosocial adjustment. When children's psychological needs are satisfied, they report more well-being and have a higher intrinsic motivation. If you observe children at a playground, you will easily notice remarkable differences among them. At home, differences might be great. Self-determination theory argues that children's psychosocial adjustment depends to a substantial degree on satisfaction of three basic needs. First need being autonomy, which manifests itself in experiences of volition, and volition practically means making your own choices. So for example, leaving on your own volition means leaving on your own choice. Psychological freedom, authenticity, and the ownership of one's behaviors and choices. Competence, in which children should feel like they can do things effectively and are able to deal with challenging tasks. And relatedness, so feeling appreciated by and closely connected to important others. Recent work has also focused on the dark sides resulting from psychological need frustration. When children's needs are not satisfied, they are likely to be frustrated. They might feel controlled, inferior, or lonely. According to the self-determination theory, frustration occurs when the needs are actively undermined, rather than just unsatisfied. Research increasingly supports the idea that psychological need frustration is predictive of maladaptive developmental outcomes. It is, for instance, related to stress, interpersonal problems, and eating disorder symptoms. So how do socializing agents, parents in particular, affect psychological need satisfaction or frustration? SDT argues that parents play a crucial role in either nurturing or hindering psychological needs of children. Difference in parent styles of interacting with children are conceptualized in three models: relatedness supports or involvement, competence supports or structure, and autonomy support. Each of these models can go either way, positive or negative, depending on how the parent interacts with their child. Relatedness obstructions are characterized by parental behaviors that are cold, neglectful, and rejecting. Competence obstructions by demeaning and chaotic behavior. And autonomy obstructions by including pressuring demands and coercion. Being low in support when it comes to these needs does not necessarily mean that parents are actively not providing it, and vice versa. However, when parents are actively need supportive, it has been shown that they will foster experiences of need satisfaction. There is not a simple one-to-one association between the need dimensions and satisfaction that children experience. For example, when a parent takes a child's perspective and thus satisfies the autonomy need, it might also be positive for feelings of relatedness. Love, care, and genuine desire to support the child are basics for this dimension of relatedness support. Parents who fulfill this need deeply care about the child's well-being. They are warm, sensitive, and build a secure attachment. This makes the child feel protected, and they learn to trust. A basic requirement for this is parental presence and involvement. This alone is not sufficient. The time spent together should also be of quality, not just quantity. Engagement in joint activities is also an important aspect. Structure gives a sense of competence. It requires a focus on the development of the child's skills and abilities. Being process-oriented means that there is an interest in discovering the child's talents and providing support to nurture these. Children learn through trial and error and differ in the timing of development, and it is important as a parent to know and understand this. The components of structure can be organized in terms of whether they are operative before, during, or after the children's engagement in activities. When a child is about to begin, providing clear guidelines and communicating limits is a good structural component. During the activity, monitoring progress in a process-oriented fashion is the most optimal. Giving advice or breaking down the task into smaller pieces is, of course, also a good component. Afterwards, informational feedback is the way to end the learning process in the best way. Activities should slightly exceed the developmental level, but still be in reach to be the most stimulating for the child. Autonomy supportive parents tend to focus on their children's perspective. Accepting a child for whom they are adds to the experience of volition and their ability to be who they want to be. 3 important features of this are fostering task enjoyment, allowing input from children and relying on inviting rather than coercing or pressuring. It is important to consider the interplay of the 3 dimensions. Especially the structure and autonomy support interaction is important. Autonomy supportive parents are more likely to provide structure and good communications of expectations, especially when the mother also takes perspective. Some parental behaviors can also give rise to conflicting interaction. Conditional regard is when parents give more love and affection than usual when a child meets their expectations, and withdraw affection when the child fails to meet the standard. This practice is quite controlling, and it leaves children to feel like they are not really loved. When it is combined with parental warmth, it might lead to a loyalty conflict, where children strongly feel like they have to choose between a close bond with their parent and preserving a sense of autonomy. Are there contextual and individual differences in the effects of need-supportive parenting? SDT speaks of functional significance. It refers to the differences in the way people appraise and interpret events. Pomerantz and Eaton found that with increasing age, elementary school children were more likely to view parental involvement in homework as signaling incompetence and a threat to their autonomy. Research has shown that in collectivistic societies, children might interpret autonomy suppressive acts as more benign. SDT distinguishes between autonomous and controlled causality orientations. This is to capture personality-based differences in the way social events are appraised. If you are high in autonomous orientation, you are inclined to see the value of interpersonal behaviors. However, if you are high on the controlled orientation, you tend to more easily experience interpersonal behaviors as pressuring and intrusive. The fact that these differences exist does not contradict the SDT's claims about universal importance of psychological needs. While children may differ in the way that they interpret support, their subjective feeling of autonomy remains beneficial. Results of research have shown that across developmental periods, across cultures, and irrespective of children's personalities, the experience of being need-supported or need-thwarted is consistent with the claims by the SDT. There are limits to interpretation. There are definitive mean-level differences between parental practices in terms of how need-supportive and motivating they are, and even though one culture might be a little bit more accepting in their interpretation of a guilt induction parenting practice, for example, they will still see it as more controlling than parental autonomy support. When looking back at socialization, SDT highlights the children's agency. They are not passive, rather they give meaning to parental behaviors. They differ in the way they cope. Future research on this might reveal why some children are more resilient and why others experience developmental problems. Thank you for listening.